particularly we are looking at right now is the infrastructure status to the healthcare sector as a whole. Now, there has been something that was accorded last year, but the industry and the sector is really not aware of the details. And hence, we have in our, from NATHEALTH also the budget proposal, we have requested the government to clarify what the current infrastructure status means in terms of, for example, tax holidays when new hospitals are being built, in terms of innovations of the technology providing companies, and so on and so forth. I would say that's one of the first expectation from the healthcare sector or industry. I said innovation. I think there is a whole lot of possibilities that can happen in this country in healthcare if innovation is supported and promoted more intensely by the government. Someone asked me the other day why India cannot be an Ireland in medtech industry. Ireland, a country like Ireland, I mean, it's not very big, but it houses the manufacturing facilities of some of the leading global players. And so is China. You know, it supports in a whole lot of way the innovation, local manufacturing, so that companies feel attracted to invest in this country. And you know, the outcome is obvious. Healthcare anyway is a very large employment generator. So you have possibility of further increase in employment. You have possibility of prices going down of technology and other stuff, so that finally the patients will benefit. The cost of healthcare delivery to the patient will be better. So that's another aspect. I would say in any way that government can support the skill development in healthcare is another important factor. We are sitting on the tip of a volcano. The demand-supply gap in terms of skill, whether it's doctors or nurses or paramedicals, biomedicals, is very large. So I would say, I think some of these areas, if the new government could look into, it will do a lot of good to the healthcare sector and the patients in general. About 35 to 40% of the investment required by any new healthcare deliverer, that is hospital, when it starts up, is on technology, which is a very large percentage, you know, I think next to land. So if you support, if a country supports, if India and the government supports local innovation and local manufacturing, there would be possibility of dramatic cost reduction. So cost reduction of technology should be translated into cost reduction of patient care or healthcare delivery, finally. That's one area. The other is, I think there is huge opportunity of saving wastages, whether it is in terms of the green, you know, you would have heard about green hospital. There is a lot of focus now to make hospitals also eco-friendly. In the process, you are actually, you know, the carbon banking, etc., the carbon credits come into the picture. In the process, you are saving energy. In the process, you are saving costs. So we have gone through hospitals around the country, and we have found there is a huge possibility of saving on these energy costs. So obviously, that also will be translated into reduction in operating cost. Finally, it should be actually hitting the bottom line as well as cost of pay, you know, cost for the patients finally. So these two are the areas that I can think of, technology as well as energy saving. There are other areas, you know, I think there is inadequate best practice sharing in India. Healthcare is I find it is a unique sector where competitors find it difficult to collaborate, unlike in other sectors. There is a lot of trust deficits. In fact, from NATHEALTH, one of the prime objectives that we are trying to fulfill is to bring multiple stakeholders together, so that, you know, they deliberate around one table rather than locking horns across the table, government, private, big hospitals, small hospitals. So if we all sit together, I think best practice sharing would give us idea of how to make hospitals more efficient, how to make technology providers install an MRI more efficiently and hence cut down on costs. The sky is the limit in terms of possibility. India, it is in terms of insurance, of course, the countries which are completely supported by government in terms of social support, that's a different issue. There are some countries in Europe where healthcare is completely supported by the government. But India has one of the lowest level of insurance penetration even today. So the payers finally ultimately most of the payers become the family members or the patients themselves. In fact, you have cases where for a heart surgery, a family has to sell its house, which is not such a good thing. So I think the last few years, the insurance scene is becoming better, and compliment to all the stakeholders, including the government, the private hospitals, the private insurance providers. IRD has done a great job in sort of bringing all the elements together. I think this is the first area that we need to further reform. So, in short, reformation of the insurance sector, making it more cost effective so that it can be more pervasive, is definitely going to be, it's not in terms of cost, it's in terms of supporting the patients and the family to pay. It's like a car insurance. If car insurance is mandatory, why shouldn't health insurance be? Okay, so I think this is one angle. The other angle, you asked about the quality part. You know, I would give a twist, and I would say that it's the right word perhaps is reliability. Quality has become a very broad buzzword and very difficult to pin down the milestones if we talk about quality of patient care. Reliability, on the other hand, it has implicit meaning of repeatability. That means, you know, I mean, you are treating one patient in a certain way and for a certain disease, and you are treating the second patient in a different way. The results are different. So I think there is quality focus in the country. You know, you see hospitals today, they proudly display that they are accredited by the JCCI or by NABH and others, which itself is a good news for the country. You know, 10 years back you didn't have that. So I think the more accreditation challenges are overcome, and this becomes part of the ethos of the healthcare system, that every hospital will, I think, compete with each other to raise their quality. Another important angle is patient awareness. You know, in our country, consumer awareness is there. In other sectors, retailers are very conscious. But in our country, I think the patient awareness is still inadequate. So perhaps there should be more focus on communication from the government and private sector to make patients more aware, so that they know that they are getting their dues, put it that way. So I think reliability would come from this ethical consciousness of the leaders in the healthcare system, that patients should get what is due to them. And to that extent, I think some good work has been done in the last half a decade, but I think a lot, you know, miles to go before we can sleep, frankly speaking. So I think what is useful is, very important is the track record of the insurance house, I would say, is an important thing. You know, of course, there are very good examples of insurance. Leading foreign companies have tied up with local healthcare systems, and they are obviously competing with each other based on quality, reliability. So I think the background information is very important. If when I buy, I check with other people about their experience with that particular insurance company. Secondly, cost is always a criteria, but sometimes in trying to cut the cost, there are some important features that may be cut off. And I think it's important to read between the lines when buying the insurance policy. It's also important to see what all are covered there. You know, if for example, needs can be different. Someone who is 30, his or her need could be different from someone who is 60. So therefore, I think one needs to see what are the items that are covered by an insurance policy. By items, I mean, is heart diseases covered? If so, how much? Is knee surgery, if required, covered? So these, I think, are the, you know, the cost part, the reputation of the insurance company, word of mouth, you know, I think good background checking is important, and what are the deliverables against that cost. I would say these are the important factors.